It is just a huge honor for me today to be podcast interviewing Dr. Simi Silver, and she's got all kinds of initials by her name, DDS, and a doctor in the American Board of Dental Sleep Medicine,
Diplomat, yes.
Diplomate Sleep Medicine.
Yeah, that's
And
right.
as a diplomat of the American Board of Dental Sleep Medicine, Dr. Silver prevents and manages breathing problems, including sleep apnea, snoring, and mouth breathing in all ages. She evaluates and treats children for proper jaw growth and development, incorporating oral myofunctional therapy, oral appliances, frenuloplasty, tongue tie release. She has recently focused her practice on treating sleep apnea and orofacial pain or TMJ pain. Dr. Silver has provided laser dentistry for over a decade using water lace. Her commitment to lifelong learning ensures that she is always abreast of current knowledge, technologies, and techniques. She has completed hundreds of hours of continuing education courses from leaders in their fields. She has 5 children and benefited from her expertise, and her passion has inspired her son Maxwell, who graduated University of Toronto Dental School in 2022. By the way, she had him senior year at dental school. That is so crazy. Dr. Silver also volunteers on the council of her local Ottawa Dental Society. She's been a member of the Ontario Dental Association since graduation, as well as the Canadian Dental Association. When she's not at the clinic or learning, she stays active and enjoys repairing jewelry, sketching, singing, and dancing. And I told her, we did this show, and we did like 1,600 episodes, 10 million downloads. We made the biggest podcast in dentistry. Then I retired from it all. But the only reason I came back, Semi, is because I just keep getting all these letters from dentists like your son who got out of school. I don't know how much student loans your son had, but they're usually 3 to 500,000 US in debt. They're working
Yep.
for a DSO. They're not happy. There's probably 10, if not 20 or 30,000 of these students. So I'm not saying you're old or mature or anything like that. You're not as old as me, but you've been around the block for 20 years, and your son is a dentist that just came out of school. So when you talk about all your passions about sleep apnea, snoring, and mouth breathing, and all that, let's try to aim it back to that
Mhm.
to your son, that girl. What do you, well, first of all, let's just start. What do you tell your own son? What would you tell a girl who's out there listening to you saying, "Hey, I regret even being a dentist. I regret everything about dentistry. I'm $400,000 in debt. I work for a freaking DSO. The office manager doesn't even respect me. They treat the dentist like cattle. I mean,
Yep.
she's not happy. In fact, she's probably pretty mad half the time. What would you say to that person?"
I say, first of all, you have to take a longer view. It's going to get better, right? So you've got to be able to, in that situation, you don't want to stay there, obviously, but I do think dentistry is amazing. And I think there's a lot more paths than you can take nowadays. So you don't just graduate dental school and figure, okay, I'm done, right? You got to take lots of courses over your career because you're mandated to, right? I assume you all have the same sort of situation where you have to take courses to get points or whatnot for your license, right? So pick what you really love to do, right? So my son, in his case, he loves surgery. I did not love surgery. So I never did a lot, right? I didn't, he does wisdom teeth, he's doing implants, and that certainly will help your bottom line as well. The other thing is, besides, just drilling and filling, those fillings and those crowns, if you get good at doing them quickly, you can make some serious cash. So keep your nose to the grind when you're in a job like that and just get the job done. Yes or no, sir, how many bags full? And keep your eye on the prize. And by that, I mean have a goal, right? So maybe 3 years, maybe 2 years, maybe 5 years. And it depends on where you're located, right? So some areas you may be able to say, okay, I'm going to do this here, and then I'm going to go open my own place over there. Highly recommend with a partner, personally. That would be my personal preference if I was opening up right now, because I think that it's a lot more work than it used to be. You might even want to consider getting somebody who has not just an office manager, right, from a dental background, but get somebody who really knows business and systems and like project management kind of way of looking at a business. So that's one thing that you can do. I guess I look at opportunities, right? It's a challenge. It's an opportunity. You're a dentist. This is great. Okay. So yeah, you got some debt, you'll chip away at it. And the other thing you're going to do is look for other investments, right? So that long term, you start well, here we have RRSPs. I guess down there you have, was a 401k, you call it, for a retirement fund?
Right.
Okay. So I would say, do what you can to put a lot into that to start, but also start looking at real estate, right? Because that's your long term as well, right? Thank God I own my building. It's probably worth double my practice. Okay. But it's hell to run a practice. It's not fun. And it used to be a lot easier. And now we're just regulated to death. So I'd say get good at running a business while you're working for these other people if you want to do your own practice. If you don't, then get good at one thing and farm yourself out. If you're really good at ortho, farm yourself out. Get really good at it. And then, over that would be your long-term plan. Or get really good at it and go back and, there's so many options online now. Oh my gosh, you could get a master's of orthodontics online. I don't know how really qualified that makes you, but there's lots of other courses you can do online as well. And so I would just encourage everybody to look into that. Now, my personal preference, obviously, is in the orthopedic, orthodontic area. Whether you call it airway or not, it's about making sure that everything is growing properly. So a lot of pediatric dentists do this. A lot of orthodontists do this. I happen to have been doing it since I graduated because I learned functional appliances and palate expanders and twin blocks and all that. So I've been doing it anyway all these years, and then realized, oh my gosh, I'm opening up airways, right? And got right into it. And I've been doing clear aligners forever and all those things. So that's what I do. But that's just an example that I'm trying to say that's what you could be doing, right? So try to take the longer vision of this. And if you really hate your job, you could go work for like an employee. So up here we have government jobs. You can work for the military as a dentist, right? Like you're not military if you work for the military is what I mean, right? I don't know how it works down there, but those kind of positions are readily available and they're always looking for them. So if that's, floats your boat better, just go do it, right? Don't look at what other people are doing either, right? Don't look at what other people are living their lives either. Just look at you. The best thing my dad said to me with regard to that is they don't pay your bills, right? We worry so much about what other people think about us, right? They're not paying our bill, right? You just got to keep your nose to the ground, focus on what you want. And maybe you need some time, get away, just go hibernate in your bedroom for a weekend or something. Or if you have like a hotel you can hide out in for a weekend and just think on this, right? Go swimming, go walking, and just think opportunity. What can I do? What can I do? What can I do? Right? Come up with ideas, brainstorm with yourself, right? There's always ideas. You're a dentist. This is a huge opportunity, right? You've got that paper that says, I'm a doctor. So if you don't want to stay in dentistry, you could do a billion other things too, right? But look at it as an opportunity, right? And don't stay in those horrible positions forever. If you got to stay there for now because there's nothing else that you can do immediately, plan. That would be my answer, right? So my son, like I said, he's planned. He's doing surgery.
And the thing that you said that just hit me so hard is take a long-term view. I remember when I started dental school and we were walking home and me and Rui were talking about how it was going to be 4 years. And it was so incomprehensible to think that we were going to be stuck in this school for 4 years. I mean,
Right.
and now that was 40 years ago. And
Right.
so yeah, you're young, you're out of school, you got a bunch of debt, you're a baby, and 10 years
God.
will go by like that. 20
Yep.
years will go by like, I mean, it was yesterday you were pregnant with your son in dental school, and now he's a dentist. I mean, it just
Yep.
flies so fast. But I want to take a longer view about you because whenever I hear someone talking about sleep or ortho or anything like that, sorry to hit you with this out of nowhere, but I just
No
get,
worries.
when you're a dentist, you love anthropology because they always find teeth. And, like when they found Lucy, they always find the teeth. They don't find a liver and an appendix and a gallbladder. They find a
Right.
hidden mineral thing. And
Bones.
you look at all those skeletons of all the hominids they've ever found, and you don't see any cross bites and overbites and malocclusions and all this kind of stuff. So why do all the primates have straight teeth and no issues? How come everyone we've ever dig up from under the ground, if it was more than 2,500 years ago, their teeth are
Right.
just normal regular teeth? And then you look at the today. In fact, I don't even think humans are mutts anymore. I call them Muppets. I mean, you look at these people walking around, and they're just they all look like Muppets. I mean, why do we have what went wrong? Some people say, was it the diet? Was it the baby bottle? I mean, but But is ortho even necessary? I mean, is it, would it have been preventable if they were nursing for 5 years and chewing on a rough steak? I mean, I've heard
Yeah.
people say that, that the minute nursing gets challenging, they switch to a baby bottle that just guzzles out milk, and there's no forces. But so answer that question. Why is it such a huge disease now, but it wasn't for
Okay.
the last million years in anthropology with humans?
Well, from my understanding, it's not a topic I've delved deep into, right? Because I get into the clinical side of things more. I accept the premise that we need these treatments, but I think that most of my understanding of the reason why that's come to that is our diets, and that's been over just the past century. Really, it hasn't been a long-term issue. And in fact, if you go to places where they, like here, we have the Inuit up north. If they're still living off the land, or if you have other indigenous peoples who are living off the land, they tend to have bigger, broader jaws, right? I see a lot of immigrants here, and I often see like people who, like, the first time in their life they've ever had a cavity because they came to North America and started eating our crappy food, right? Or they had gum disease out of nowhere, same problem. Pardon my coughing dog in the back there. So she has a lung condition. So yeah, so I think that that's the biggest reason why, from my understanding, but that's not a definitive answer. We'd probably need to talk to Dr. Boyd, right?
And so what? So when you look at the 12 specialties, where would you put sleep under? Oral facial pain, oral medicine, oral path.
That's a I think I would put it under orthodontics, but
You put under orthodontics.
I think so, but it is a collaborative approach, right?
Yeah.
So orthodontist might not do a tongue tie release. I do infants, right? Myself and my son do all ages tongue tie release. So I don't know that an orthodontist would start doing that, but we also do MARPI, right? So whether or not you're getting somebody who is an orthodontist or a GP with a lot of training, that's what you need, right? But it's not orthodontics, right? It's orthopedics. So that's, I think, what they've changed all of the schools now to be called: dentofacial orthopedics and orthodontics. They're not calling them orthodontic graduates anymore, from my understanding, the few schools I've looked at.
What do they call them?
I think that it's collaborative too, right? You do need to involve more than just one specialty, for sure.
So where did your passion for sleep come from? I mean, was it always there, or what was the epiphany that made you
Yeah,
change directions and
it's
pivot
a
towards sleep?
long story or the short story. The short story long, I guess. The short version of the long story would be that I have had 4 premolars removed. I had a cervical headgear, and within 4 years of brackets. And they took off my braces, and I still remember that feeling. Oh my gosh, my teeth are so smooth. It's amazing. And a month later, I got sent for a night guard, and I've been grinding ever since. And then I found myself at dental school going, tell me about this TMJ. Not learning anything. Nobody teaching me. Okay, fine. I'm learning brackets. I'm learning all these functional appliances. Nothing about TMJ. Zero. So then I just keep going through my career. And eventually I have a water lays, so that I've had over a decade. And my good friend, Dr. Polanski, Marina Polanski, I don't know if you know her name, she teaches for ALD, Academy of Laser Dentistry. And so she's the laser queen. I'm just the laser princess. And she says, why don't you do the babies, right? And I said, okay, so I better take a course, right? I'm not that brave. They're infants. So I went online and took Larry Kotlow, Dr. Kotlow's course. And the light bulb went off. I'm like doing palate expanders my whole career, and I'm like expanding and what? And wait a minute, that's why my palate's so high. So yeah, it affects me. Then it becomes personal, right? So that's why it was a big passion, because it affects me. My son, who's a dentist, has severe sleep apnea, but now he's down to a 12 with his MARPI, or we think he's down to a 12. I shouldn't confirm that. And it's other 2 or 3 of my other kids. Can't keep track. And even my poor dog has an airway problem, but I can't help her. But it's been also me. So in fact, after I started learning about tongue tie, I myself was able to find out that I have a connective tissue disorder. And it's called Ehlers-Danlos syndrome, which you may or may not have heard of. And the crazier part was I'd never heard of it. And there's a periodontal version. And there's another dentist here who has it as well. And her good friend, and my friend as well, but like they're very close, is a periodontist. And she'd never heard of it. And I was like, what the heck is going on? No, we don't learn about tongue tie. We don't learn about TMJ. The periodontist doesn't know about this particular condition. Like something's missing. So I just kept learning and I just kept learning. And here I am. And I couldn't really practice so much general dentistry anyway, as I went through menopause. Yay, I love being a woman. So I ended up just devoting myself to all the orthodontics and orthopedics and tongue tie release and all that fun stuff that I do, and the jaw joint stuff and facial pain. So that was also because I was in pain all my life. Just to explain that, right? I figured, and then I realized when I have this condition, I was like, oh, so like my patients don't actually know what pain is. Okay, gotcha. But by then I already knew how to do Botox and trigger point injections and laser for pain. So, one thing at a time, I would add sort of different modalities, thinking that and I did help patients as well as myself, though. So that's
Well,
the
you said
shortest version.
something, I hope it didn't fly over the young ones' heads, because it's very profound in the fact that, when you look at the 1 million physicians,
Yeah.
90% of them don't do any surgery.
Yeah.
They don't need 2 eyes and 2 hands to do their job.
Right.
Dentistry is 99% surgery. It's all hands-on surgery. Just like lawyers, only 1% of lawyers litigate.
Yeah.
99% don't. They all talk. But when you're dealing with a litigator, that's the guy who's going to sell it in court, and the judge. They're just far better attorneys. And dentistry, my gosh, if you have an implant and you're placing implants and doing bone grafting and all this stuff like that, and you start getting any physical issues, it really impairs your job. But it really doesn't if you're an orthodontist.
Right.
And
Very
you're, so yeah, so
Yeah. I
getting
wouldn't
to
be.
have
Yeah.
a realm of dentistry where you could have an
Yeah.
arm in a cast, or you could, or you could.
I could be in a wheelchair. I'll just roll around everybody and go, okay, open, close. Okay, good. And then I'll tell everybody else what to do.
Now, there's a guy in Wichita who just crushes it in a wheelchair. I think he got shot
No.
he was at a convenience store. They got robbed and he got
Oh,
shot. And
I
oh man, yeah.
really. Oh,
Yeah, but he just crushes it. But yeah, so yeah, I also want to back up on that water lace, because whenever you talk about a decision that's $100,000, the dentist, their ears perk up, and they take it real serious. So
yeah.
you didn't say that you liked some 12 blade that cost $1. You like a water lace. How much is a water lace? So go do a little
Right.
deeper dive into water lace, because how
Sure.
much does that thing cost nowadays?
I think it's not much more than what I paid. Back in my day, I paid like 80, I think, Canadian.
80,000
So,
Canadian.
yeah. So
So that'd
nowhere
be
near a
like
hundred.
$12 in the United States.
There you go.
$13. No,
You can
but
buy
no,
three.
but $80,000 is a big decision. So
Yeah.
so so talk about that. Well, would you buy that same thing today? Would you spend $80,000?
100%. Absolutely. I
Okay,
could
explain
not.
why. How does the math on that work?
The math works because there was procedures I wasn't doing before, like crown lengthenings, right? Like not big quadrants of them or whatnot, but like let's say you have just the distal lingual or the distal buccal lingual margin on a crown, and you need to get some crown lengthening there. No problem. Get your tip out, do your crown length, and there's no bleeding. You take your impression, and off you go. Done. Right? Do those little tiny class fives or those little incisal edge wears, you suddenly can do them because that laser is just going poke, poke, poke like a pin, right? It's so precise and no freezing. I do all the kids with no, well, did all the kids with no freezing, even pulpotomies and pulpectomies, right? You can heal little things. People just love it, right? If you love something that you're working with, they will love it too. Okay.
And when
And
you call it freezing, to the international group, that's numbing it up or using
yeah,
anesthesia. But usually when you use anesthesia, you leave the room, you let it soak in for 10 minutes. So if you're not having to let it soak in for 10 minutes, I
right.
mean, you just, I mean,
And you know,
that's a
yeah,
very fast procedure when you drop that 10-minute numbing.
right. Well, especially also those little incisal edges because there's so many people with so much wear, right? and you can't usually get in there because your burr is going to spin and chip off the enamel, right? It's too small, even if you could get a burr in there. So this way you're just roughening up a little bit, and boy, does that stuff stick. And then you replace them every 3 to 5 years. You can also use it to prepare the tooth if you're doing a sealant, right? Then we're calling it a preventive resin, but you know you're going to get good adherence. That sealant's not going anywhere.
And you know what? I don't even believe in sealants anymore. I mean, I haven't believed in sealants for 20. I mean, you're taking a technology where you acid etch enamel, and you're acid etching pits and fissures filled with Oreo cookies and Baby Ruth bars and Butterfingers and dirt balls. And every time, and I started with air abrasion back in like 87, right? There's air techniques, air abrasion. And it was just air abrasion. I'd clean out the pit and fissure with air abrasion. 100% went to the dentin. I've never cleaned out a fissure with a water lace, micro air abrasion, even a little Danaher micro etcher. I mean, you can't clean out those pits and fissures without getting into dentin, and then it's an occlusal composite. I mean,
but I'm not doing that.
Right, but an occlusal composite. But when you clean out all the pit and fissure and do an occlusal composite, in 5 years, 95% of them still work. But when you do a dental sealant, in 1 year, 40% have failed. And in 2 years, they've all failed. I mean, they've all come off because you're acid etching to pits and fissures filled with crap. So I think of it when when a 6-year-old child gets their first permanent molar, and they're only 6, and they're gonna have that tooth for 50, 60, 70 years. I just think it deserves to be completely cleaned out and done with a preventative resin restoration, occlusal composite. I just don't think putting acid etch.
Oh, I see what you're saying. Okay.
Yeah, I think acid etching pits and fissures filled with black crud, so that in 1 year, 40% all chip off and break, and in 2 years, they're all gone. I mean, there's no, the only successful sealant is when someone does a occlusal composite, preventative resin restoration.
I never go down into the dentin unless I start chasing decay, but I'm at least roughening up, and if I can't get in, I don't go down that far with the laser. And I don't find that they come off that quick. They usually last quite a long time, but I'm also like, I'm if I wasn't using the laser, right, if my hygienist is doing them, we're etching, pumice, and then etch, and I use bond, right? So we do put some bond, I don't cure it, and then I put the sealant, and then I cure it. So it stays for years. Maybe you just need some help with your technique, Dr. Farran.
Well, no, I just when I spray them all out, when I take that air abrasion and spray out the whole pit and fissure, it's always down in the dentin. I've never done that and not got into the dentin. I mean, somewhere in that deal. And I just think, but it's the tooth most likely to be missing, the tooth most likely to be root canal, tooth most likely to be replaced by I mean, the 6-year molar was condemned to hell at birth. And so to do a quick and dirty sealant on the tooth most likely to die and go to hell is just not the but anyway, so on this sleep. So again, tell me what was the pivot? Was it in dental school? Was it 5 years out, 10 years out? Was it just recently?
No, it was only about in the last 5 to 10 years. Like I had to give up general dentistry about 2 years ago. I'm 57 now, by the way. I'm not shy about my age. I graduated almost 28 years ago. And it's been the past 2 years of not being able, like at first I just thought I was maybe burnt out and, just needed some downtime. And it became pretty clear I could not go back to full-time dentistry. So I do the odd filling or whatever now, but I can't do a whole day of general dentistry. So I can do a whole day of ortho, though, and orthopedics. And, I had a baby today that we released. And for me as well, that's very rewarding. So you need to also, I think, go with what motivates you, right? I'm that person who's that compassionate, empathetic. I'm super happy whether you pay me or not sometimes, right? I'm just happy to improve someone's life, especially an infant. I'm changing their entire life. And I've suffered my whole life with airway issues, right? So I really know that I'm really changing and preventing these problems, right? It's just, I think, something that you have to look around at yourself and go, okay, I've been practicing for a while. What are the procedures I love to do, right? What are the articles that I love to read, right? What are the courses that I love going on? And just keep going. And eventually you'll find that there's a lot more information there that you didn't know about that you can get into. And the cool thing with sleep is that it's a very new area for medicine as well. And so the doctors are still learning as well. We're learning so much about what sleep is for, why we sleep, how sleep works. It's quite an exciting field. Now, if that doesn't float your boat, go learn something else, right? And like I said, don't even stay in dentistry then. You've got a piece of paper that says, I completed something. Yay me, right? I'm pretty cool.
Well,
Then go do something.
well,
That's okay too.
I do want to say something else, that the one thing I have noticed in doing this, for 40 years, is that people like you, they always have one thing in common. They always kept learning. They always kept learning. And I think that's why I was always a big fan of the AGD, because, they want to, the government says, I don't know what it is out here. It's something ridiculous. Like we have to have like 20 hours every 3 years or something like that. But it's the
Yes.
people that take 50 to 100 every year, their whole life. It's the subject, it's the brain food, it's
Yeah.
the energy from the classmates. I don't know, looking back, if it was, some of the guys I was sitting next to
Yeah.
during the program, or but
Well,
something.
like my buddy, the laser queen, right?
Yeah, it just.
Oh, it's all her fault. Oh, go do the babies. Oh, wait, I need a course. Before I know it, I'm going down the airway rabbit hole, right?
Yeah, and I think it's a guarantee that if you just commit to 100 hours of continued education, and now it's so simple online. I
Oh
mean,
my
because of the
gosh, right?
pandemic. I mean, the pandemic. In fact, I can't believe it. I
Yep.
just passed my 4-year anniversary of not lecturing. I mean, I lectured 3 out of 4 weekends for 3 decades, and it was the pandemic. I mean, I was booked 5 years in advance, canceled everything, and
Wow.
and now it's been 4 years, and it's like you don't need to. Like, we're meeting on Zoom. You can take the Dental Town online courses, they're 1 hour. My
Right.
gosh. But you just
There's
keep.
more than you can take. There's not enough time to
Yeah.
take all the.
And you
Yeah.
never know
It,
where it's gonna go. Like I was a member of the AGD, and I was arguing with the guy a lot because I didn't know why a general dentist had to take classes in ortho and implants. And I was like, I kept
hmm.
arguing, and he'd always just put his arm around me. He said, "Look, there's a lot of forefathers out there, and a lot of times it's the you might learn something in ortho that applies to removable dentures. You might learn something in implant dentistry that it's all cross training. And I know you're not going to do ortho, not going to do implants." But if you want to get your FAGD, you got to do this. So I was all mad as hell. Arizona didn't have a dental school back then. So I had to fly all the way to Pittsburgh, and I signed up
Oh,
for this 7 3-day weekend course with implantology
oh,
with this guy you
right.
probably never heard of before, Carl Mish. I'd never heard of him. And oh my God, it was like discovering a whole new
You
continent.
say his name again? What was that?
And it was the same thing with ortho. It's like when I took ortho, it's like I'm never gonna do ortho, but you learn all this cross, and you never know what's gonna pique your interest. Like you could
Yeah.
have just as easily got excited into molar endo or placing implants or
Oh,
bone
I love
grafting
those too.
as you did sleep. You did sleep.
No, but I love endo. I still do endo. I do, but apparently some dentists, like I didn't realize you would probably be more aware that some dentists apparently hate endo. You either love it or hate it
Oh
is
yeah.
apparently the thing.
Yeah,
So
well, I believe that there's two types of dentists really quickly. They either get into
yeah,
blood and guts or soft and pretty. They either like bleaching, bonding, veneers, Invisalign, sleep, all that stuff like that, or they want
okay,
to, like when I walk out of surgery. I mean, I like to look in the mirror and see at least 3 drops of blood on my head. I mean, if
okay,
there if
yeah,
there's not
that's not
if there's not a drop of blood on my forehead, I know I'm not working and it didn't deserve to be clocked in. I mean, you either love blood guts or you don't. But
yeah.
and same thing on endo. The blood and guts guy like me, we want a puff of sealer out the apex, and then all the soft and pretty people like the half millimeter from the deal. But anyway,
Yeah. That's
So
so true.
you
That's
said
my
something
son.
else. You said something else very profound, and I wanted to come back to.
Oh,
You got to wear a lot of hats as a dentist. I mean, you got to do
sure.
business, marketing, HR, all that stuff like that. So you said get a partner. But a partner, I mean, like in marriage, half of marriages fail. My marriage failed to Ryan's mother, but Ryan, that was all your mother's fault. That had nothing to do with me. He's sitting right there.
Absolutely.
I tell
Yeah,
all
me too.
four of my boys
Me
that.
too. His fault.
But
Actually
but
was.
but there is a lot of hats to wear. So you're recommending to these young dentists that they have to compete against DSOs.
Yeah.
And they have entire divisions for marketing, location, supplies, all that kind of stuff like that. So you recommend a partner and talk about that. Do you have a
Um,
partner now?
no, I do not.
So you're
But
solo.
I'm solo. It's tough though. Like all I do is work, right? It's like 10-hour days, not working with patients necessarily, but working on the business, right? I think that like there's a couple I know here. They're not a couple they're not married or anything. They're married, but not to each other. Two dentists who did just that here outside of Ottawa. And I think that the model is something that should be looked at. I'm hoping that there will be like some kind of advisory company that will come and like collect all these people and help them with, doing all of the like not as a consultant, but say, okay, well, here's your employee manual. Here's your, give you all the regulatory stuff and keep you updated regularly, kind of like how your emergency kit is regularly. If you sign up, they just send it to you before it's expired, right? So similarly, it would be great if there was an organization that would do that to help people with the regulatory side of things. But then the rest of it's just so much work that it's nice to have a partner. If you don't have a dental partner, go for it and get, like I said, just a business partner, somebody who's just got some skin in the game and knows how to run a business, right? And never mind the dental. Let you go do that. But if they don't have skin in the game and they're just a dental assistant who then became an office manager, you got a lot of training to do, right? And it'll come and you might find that right person and then they might leave because they aren't an owner, right?
Okay,
So that's where
I want to talk. I want to ask you a very personal question, and you don't have to answer it. In fact, Kyle can even edit out the question if it's offensive. But so, have you thought about being a partner with your son? I mean, he's blood. Have you thought
in
about
my
going into business?
dreams, he won't. He's making too much money farming himself out all over the place, taking out wisdom teeth and doing all on foreign stuff, right? That's what he's getting into. So he goes to two denture clinics. He places all their implants. He goes to and he might move back to Toronto as well. That's the other reason because his wife. So yeah, I wish in my dreams. He's amazing. There's nothing. Are any of your kids dentists?
No, for I thought the baby was gonna, but he didn't.
Yeah,
Um,
no, it's the best feeling. I can't describe to you. It's like the pride. You know that feeling when you look at your kids, but then like he's doing surgery and he's doing tongue ties and wisdom teeth, and I'm just like, wow, like I'm not the blood and guts girl, right? I think during the beginning of COVID, I was open for those 4 months when everybody else was closed, and I pulled more teeth in those 4 months than I did in the past 4 years, I think. And that was enough. I'm like, check that box. I'm good. Right. So he loves that stuff though. And that people need it. Right. So he has more work going around to other offices doing that. He wouldn't be settling down. So, but if anybody else is up for it, I'm game. Let's go.
so, are you
I'm
looking for a partner right now? Or are you? I mean, are you looking for a partner now?
Yeah, I'd be open to it. I have a lovely associate, and she's busy. She's young. She's busy with her family, so that works okay for the general dentistry that I no longer do. But I would love it because then I could
You would
say,
love what?
okay,
You mean someone
you
that
take
buys
care of all
in?
that crap.
You mean you would love it if someone buys in a
Oh
partnership?
yeah,
So you're looking to sell half of your business right now to?
I haven't officially been looking, but I totally would love that. I mean, I've been looking for years. I was always open to the idea of bringing in a partner. I got 5 kids. I was a single mom. You kidding me? Like, would have been in my dreams, right? And plus, I own the building, so that's another level of not fun responsibility. And you're always the go-to person, so it's nice to have somebody else to share that with, for sure.
Right.
You know,
Right.
I would think that would be just something you have to be. You need a coach, I think, to be able to don't look at it as an adversarial situation, right? I'm a fairly tolerant person, so I would always question, okay, well, is it just like we must do it this way? Or is it really like, well, we have the same goal and let's get there somehow, right? Because people get their shirts in a knot about the dumbest things, right? So definitely you need some good coaching, planning, and you don't just want it to be like, oh, well, if we don't get along over some issue, then we're going to go to whatever it's called, some kind of, oh gosh, what's it called? Arbitration, right? You don't want to go like that legal official route at first. You want to first try and find a way to manage and have those discussions and get through them and communicate through them and figure it out together, right? It kind of sounds like a marriage, doesn't it? But that would be ideal, right? I do think that, again, I would love to see an organization that would take this on and support those dentists, or dentists who would start an organization is what I'm thinking, right? Who would go and say, okay, I know that in Toronto there's some independent dentists federation or something like that. I don't think they've done too much, but along those lines is what I think needs to be done, because the DSOs are I don't know. I'm not a big fan of the ones I see up here. So it concerns me. Some of the smaller ones are pretty good.
Well, I was writing I was writing today about DSOs. I was writing something I'll tell you what I was writing about DSOs today. I'll just say real fast. The most
Mm-hmm.
important ingredients of capitalism are private property, private control, the factors of production, accumulation of capital, and competition. Necessity
Mm-hmm.
is the mother of invention. Competition breeds innovation. Perfect competition is considered both the ideal and default state in Economics 101. Pizza Hut was the king of pizza, but it took Domino's to innovate the corrugated box so you could have
Oh,
deliveries, because
mm,
Pizza Hut would never do deliveries because those boxes were all flimsy and they would melt, and delivery wasn't a thing. But Domino's
okay.
actually got a guy to build a corrugated box.
Wow.
McDonald's was the king of fast food in all 50 states, but it was Burger King who came up with a signature sandwich, the Whopper, which forced McDonald's to come up with a Big Mac, and it was Burger King who took the first hamburger ad on television. So if it wasn't for before DSOs,
I'm
you could
learning
not
from you.
before
Wow.
DSOs, you could not find a dentist open on Sunday. I mean, I
Right.
told people, I'd say, well, no, dentists aren't real doctors. And they say, well, we're not even real doctors. I said, well, you're not a real doctor. I said on Sunday, if you fell off your bike and broke your leg, the ambulance will pick you up and take you to the hospital, and an orthopedic surgeon will fix it. But if you knocked out your front tooth, there's no chance you could find a dentist. But it wasn't until the DSOs came here and started
Yeah.
opening up some offices 7 to 7 Monday. And also back when I was young, the only jobs were in the family. Your dad had to be a dentist, or your uncle, or your mom, or someone, or the military, or government public health.
Uh,
Government public health, or but now the DSOs, 80% of them work for private business DSOs. And
yep.
let's see. Oh, and just like Burger King was the first fast food hamburger store to run a television ad, Clear Choice Dental Implants was the first to use television ads before and after. And I'll tell you what, they when they came to Phoenix, Arizona, they started running these 30-minute infomercials around the clock, and everybody was coming in asking about implants. Every oral surgeon I know would badmouth Clear Choice Dental Implants, and then
Mm,
all of his patients would be asking about implants that they saw on their commercials. So it's
yes.
it's it's knee-jerk stupid reaction to be against competition. Competition is everything.
Yeah.
And Milton Hershey became the richest man in Pennsylvania with the chocolate bar, but he fired a man that worked for him, and that
Oh,
man didn't even leave the city, and started Reese's Peanut Butter Cup. His name was Harry Burnett Reese, and so he became the second richest man in Pennsylvania.
I think I might have helped him get richer.
Yeah, yeah, Reese's Peanut Butter
Yeah.
Cups. It's amazing, but yeah, I think competition's good. I think the
Yeah.
DSOs are very good. I mean, they get the best locations, they have the best advertising, they have the best. They're on television ads. They
Okay.
train their receptionist to answer the phone. But what they
Yeah.
can't do is what you keep saying. None of their dentists have skin in the game.
Yep.
So, so every dentist that has skin in the game is going to be that top half, that top 50 percentile. And then all the
Mm.
dentists that don't have the ambition to have skin in the game, or don't want skin in the game, or just want to clock in and clock out, they're not swinging for the home run. They're not trying to get a goal from the other end of the hockey rink. I mean, they're just,
Yeah.
so yeah, it's good and bad. But I want to tell you, when you listen to any earnings call, and you got to remember, in the last 2 years, the stock market's gone from about 18 times price earnings for the market. It's expanded to 21 times. So all this market gain is just an expansion of that. But every earnings call talks about AI, and you're using AI for CBCT with
Yeah.
sharkbit.com, and Ryan is obsessed with AI. And so tell us. I went to the link, Sharkbit.
Shark bite.
Shark what?
Bite.
Is it B? But it's BIIT.
Correct.
But it's pronounced bite.
Correct.
Okay. All right.
Yeah. So
I'm
talk
going
about
with it.
internet. Her and I, the woman whose company that is, Dr. Jenny, I'm not going to do her last name justice, Chernobylsky. Ukrainian much? Yeah. So, right. And yeah, so she's a prosthodontist who is now focused on this company, which will be able to launch hopefully soon. You can see all the information on the website there, and hopefully it's going to actually diagnose sleep apnea from CBCTs.
Should we podcast her? Hey,
Hell yeah,
will you send her back to podcast?
I certainly will.
Because this AI thing, you got to remember, we're old school. When I was a freshman at Creighton in 1980, they talked to us about artificial intelligence that was invented by IBM in 1950. And so that was 1980.
Yeah,
And now it's
right.
2024. So that was 44 years ago. So now when all these people are talking about AI, it's like, okay, we've heard about AI our entire life. But now it looks like it's starting to finally pay some
Oh yeah.
dividends. Are you using SharkBite? Does it help you?
Yep. Yep. I get my reports from her company. So yeah. And I'm going to be helping her with teaching so that we'll get I'm not sure at what stage she's at with that. I think she might still also be looking for investors. So that is part of what she's doing now as well. She's in Toronto.
I'll give her your son's name for the investors. He's making all the money. He's making all the money doing implants and.
Yeah, the same kid who has all the debt, right? Like we're talking about the same kids.
Well, hey, I would love to have her, maybe you and her both come back and talk about AI and dentistry, or just her come back, or whatever. But AI is, I mean, you cannot listen to an earnings. I mean, you listen to Kellogg's cereal and they'll talk about AI in cornflakes. I mean, it's just everywhere.
Not used any AI yet? Did you not pop Chat GPT on your phone when it was free for a bit?
I did. But Ryan, I bet you he told me to download Chat GPT for what, 6 months before I did it. And it was your brother Greg who made me. And
Well, you have these children who make you do things. Do they like, will they punish you and consequence you, put you in your room for
they could. But yeah, I mean, I really do think AI is. I think when all the people are talking about it's going to take over the world and all this kind of stuff, it's like, yeah, can we just get it to do? Can we just get it to find a cavity on an X-ray before it's going to take over the whole world and the singularity and all that bullshit? It's like, well, it's a bias for kids. They think everything's going to happen a lot faster than it does, and as you get older and older and older, you realize that like. The economy, like productivity, it's usually only like 1.5% to 2% a year. In fact, from 500 A.D., the fall of the Roman Empire, to 1500, the Renaissance, that 1,000 years, there were no gains in productivity. Economics was zero for 1 millennium.
I feel like I learned that one somewhere. But yeah,
and you learn as you get older, as you get a grandpa, Ryan, that everything takes 10 times longer than you thought. So it's a very childish thing to think, oh, they invented AI and they'll take over the world. in
Yeah.
a year. No, no. If they're going to take over the world, it's going to be 5 generations. It's going to be,
They're not even doing my dishes yet. Okay. So if they're
yeah,
taking over the world, can they first figure out how to give me a hand around the house a bit first? I mean, like,
yeah,
really? Right?
yeah, yeah.
Said though,
So, so,
I stretch, but who knows?
so I think that's super damn cool that you're using AI in all this, and you think you think this is the real deal. This
Oh,
shark bite.
I mean, that's not the only, I mean, I'm sure you're familiar. There's, who does it? Radiodontics, Dr. I forget his name. Is it? Oh, I'm going to say wrong. I think it's, no, I'm going to say the wrong name. But anyway, he uses some AI as well. But also Dr. Tamimi, she talks about it. She's a radiologist, a dental radiologist. They don't talk specifically like Dr. Jenny. She's got specific proprietary algorithms that will diagnose, right? That's different. But a lot of people are using, there's, I forget the name of the programs, but there's AI to find cavities and do all these other things. So I don't think
Yeah.
it's that crazy. I think it's quite exciting. It's just expensive, right? Like as soon as I started getting into tech, I was like, are you kidding me? And now I'm looking for somebody to a new guy to maintain my computers. And I'm like, what? Like, there's no margins left. How do I, how much is somebody going to want to pay for a filling? Well, I have AI, so you have to pay more fees now, right? To diagnose you and all this, right? It becomes there's got to be some changes along that, right? Because it's just not sustainable. Like I don't even have like I've got. I mean, I don't know how some of these guys do it. Is I think they know how to do it. Like they do their own printing, they do their own designing, all this stuff, right? But you have to be really familiar with computers. Like when I first opened my office, I was pregnant, by the way, with kid number 5 when I opened my office. And he just came to work with me for the first like 8 months. He was the easiest baby though. But the thing was that, that was just like 2 rooms. You had a little reception, it was no big deal, right? And I had paper. I had one computer. I got 10 computers now, right? And I found out pretty quickly that after 5 years, they're obsolete. So that's a huge chunk of change all the time. And that's just to have computers, never mind all the tech that gets involved and all the programs and all the stuff to support your tech. And now everybody needs to get really, I think it's super important because of the risk of cybersecurity, right? A lot of offices have been targeted. So that's where I think it gets expensive is the problem. But otherwise, I think it's a fabulous tool. Just amazing,
Yeah,
you know?
it's funny how when you listen to all these Wall Street people and they talk about risk in the market, and sometimes they
Mm-hmm.
talk about the Ukraine war in Europe. Sometimes they talk about what if China, goes to war with Taiwan. They talk about the pandemic, all that stuff. But man, when you listen to anyone in finance, they only
Mm,
talk about like Jamie Dimon. They only
okay.
talk about cyber security, and they only talk about what would happen if they start, cutting underwater cable lines, cutting off, the access to the internet. I mean, and you listen, Jamie Dimon is spending $5 billion a year of his own money just on cybersecurity threats. He thinks that is the unraveling a lot more. And think if they start doing that stuff with AI, using AI to do terrorist stuff. But well, here come
Mm.
around to show her. She's showing off her son. I gotta show off my son. This
Hello.
is my AI son. But hey,
I've been following your dad for years. You're you be a lucky person there that you got a fun dad.
well, hey, I want you to do the close, and I want you to do the close again, just like we started. I want you to talk to that 26-year-old girl, $400,000 in debt. She's been working at Aspen, DSO, Canadian McDonald's, whatever DSO deal, whatever, and she is not. I mean, you look so lovely and happy. You just look like you're just full of life and energy. You're the sweetest thing, but she's not. She's not in a very sweet mood. She'd claw your eyes out if you told her that you love dentistry. Talk to the close talking to that girl.
I think that I'm going to use my perspective lecture here. When you have kids, right? They always tell you, oh, which lecture is that? My perspective lecture is what lens are you using, right? So the lens that you use to look at things is going to change your feeling about things because it's going to reflect back at you as well. So for me, I watch the news every night. I have to watch the news. And I feel very blessed after watching the news because holy crap, there's a lot of shitty things going on out there. And I'm blessed. I don't have those kind of shitty things. I got other shitty things, don't worry. But, I don't have those shitty things, right? And I think at the end of the day, I would say just like to take that long view, just to remember that you're going to chip away at the debt and you're going to be okay. It's going to be okay. It's not maybe what you thought it was going to be because life never is. It's going to be something else and it's going to be okay. And you'll get there. Keep chipping away, figure out how you're going to get out of that job that you hate and plan and chip away. I think that that's probably the biggest problem is that you think you got out of dental school and here's easy street. No, life's not easy.
I love what you say. And you say that, I mean, how bad is it? I mean, if your biggest bitch is that you're a dentist in the United States of America or Canada, I mean, come on. Because I love history. And I mean, have you ever read, I mean, I'm from Kansas. Have you ever read what it was like through the Dust Bowl for 4 years? 4 years, no rain, blowing sand. When that thing was over, there were no dogs, cats, cattle. Everyone had eaten their last horse, dog, cat. 1/4 of the houses were vacant because everybody had to fall back to whoever had the most resources, the water well. And then World War One, there's another 4 years. World War Two, another 4 years. You're not. Yeah, you're working at a DSO with $500,000 debt, but you're not living through the damn Dust Bowl. There
No,
are worse things that could happen.
I didn't grow up with money. My mom was disabled on welfare. And I paid my own way since I'm 17. I paid my way through dental school. I got, been on my own since then, living on my own. I'm talking about really paying my own bills. Okay. And I had a chunk of change. My debt at the back then, and when I graduated in 96 was 50 grand, but took me 10 or so years to pay it off. It got done. I went through, never mind that, that money that those kids owe. Like life happens, you owe tons of money for all kinds of things, right? You chip away at it. So I think it's also a perspective of like how to live with money, right? So that you're going to buy a house, for example, and it's going to have a mortgage. You're not going to pay it off in 5 years. Not usually. That's not usually the plan, right? So that's where you have to put that student debt as well in your mind. And that will help also with your perspective. It's something that you put out of your mind. You write your check every month to pay it off or however you pay it. And that's all you have to do. That's it. You don't have to worry about it. You do you in the meantime. Make sure you can pay that debt off, but go do your life. Go do what you want. You're right. You're a dentist. This is like you have so many opportunities
And see, I can tell you would have had the same killer attitude all the way through the Dust Bowl. It's like you'd be standing there saying, well, we're not dead. We're not dead. We're still alive. Come on, it's going to rain someday. It might take 4 years, but it'll rain someday. But hey, thank you so much for coming on the show. I love your energy. And thank you for all you do for dentistry. Thanks for coming on the show.
Thank you for all you do for dentistry. And thank you for having me.